So I'll pass the mic to Dr. Mittal because there are very complex, very complex issues, whether it is Folwhite and Shell-Cal or the vaccines that came for COVID and vaccine hesitancy in tribal India, and whether the hesitancy is justified or whether we launch green revolution when we are 35 and when we retire we talk about evergreen revolution. Wisdom comes only after retirement in the services, isn't it? So I want to pose a very complex challenge to Dr. Mittal and Dr. Desai, and of course all the panelists today. So all of you, audience, will also get an opportunity to speak. But if you have been here yesterday, then you speak a little more, and if you have just come in today, like our friend here, then you hear a little more. Yeah, this is for my friend who just came in. Yeah. So wonderful. So I pass the mic to Dr. Mittal to anchor this about 40-minute, 45-minute, 30-minute session of questions. We can carry over these questions over lunch also. I know it is contentious, very contentious. So I want to just preface this by saying that my child, my second son, was born in Chennai in a gynecology center that has been used by 4 generations of my family. And he was born under the care of my mother-in-law. So my mother-in-law would not, though we were anti-vaccine, immunization family completely, it was anathema to my mother-in-law that my child would not get the first few doses, diphtheria, DPT, the couple of virus when the child is still so tiny and tender and coming back home. But later we decided that absolutely no to any kind of vaccination. Okay, and I faced a double paradox, so that was challenging. Dealing with my mother-in-law was easy. Dealing with my 22-year-old daughter who had studied psychology and biology was far more challenging. I had not prepared for it in life. And she was the first one to contract COVID in our home. And she said, Papa, apni zindagi ke saath khel rahe ho. You're playing with your life by not vaccinating yourself. And all my belief systems I had to keep aside, and at the risk of losing friendships with wonderful people, because I needed to maintain peace with my daughter, I got a couple of shots. Now, whether it led to more hair loss, whether it, what it all it led to, I will know after retirement, because all wisdom is post-retirement only. But with that context and that story, I'd like to pass the mic to Dr. Mittal. Thank you.
Exactly, I'm not sure what should I speak on, but let me put it like this, that very briefly, because each of the subject is so vast, like everything else. So, but since Vijay Charya ji has surprised me by bringing on this table, मैं इनको कितने सालों से 30 साल से जानता हूँ, शायद 25 साल से जानता हूँ, तो I don't want to say no to him, and he's sort of carried on the health battle in his family in his own way, so that is good. So let me put it this way, that the vaccine debate is one of the most contentious debate these days. Maybe I'm speaking out of context, maybe I'm speaking to what has been discussed for the last 2 days. And previously the debate used to be on very scientific neutral parameters. So each side was trying to put its data and debate that and discuss that, but now it has come to literal blows. And people who are not accepting vaccines are being attacked literally in all possible ways. And you must all be knowing about this so-called measles epidemic going on. And the people who got measles blame those people who did not take measles vaccine. And so it's a real frenzy these days, very difficult to discuss. That is the problem of the times in which we are living. This was not so 10 years. Now I'm almost 45 years in the profession. Now I've already declared that I'm out of it. That was the reason that I did not give a straight answer to Vijay Charier's. I don't know, because I'm out of the debate. But let me say that the vaccine debate was kindled by people who got influenced with a group of people who oppose the MMR vaccine, saying that it is causing autism. And they asked Tony Blair whether you have given your child You know, it's like today somebody is asking a prime minister, what is your degree? So he's saying it is my private matter. So Tony Blair said, he had a young son at that time. I was in UK, and Tony Blair said, no, 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 I cannot answer it. It is my private answer. So I don't know whether he ever answered that. And so people got very skeptical, and the more and more children are saying, people are saying that are emerging with autism, whether we are detecting more and whether actually autism is increasing. But that cast a whole kind of spell in Europe and America, and the anti-vaccine lobby of the parents, not of people like us. Anti-vaccine lobby of parents is very, very strong. So आई हैड हमारे भाई साहब बैठे हैं, आपका क्या नाम है? सॉरी, यू आर ए होम्योपैथिक डॉक्टर. हाँ, sorry, I'm mixing. Dr. Hardik. So when this whole drama of COVID began, sorry, I'm saying it drama. So we had a Zoom meeting, interestingly, in which Dr. Rashmi was there and Niket was there. Quite a few. There was one person whom you might probably be knowing, Dr. Prashant Shah. Have you heard of him? He's died. He's died. So he was after my life. I should be the one who should write a book on vaccine and COVID. So I've still not written it. He's died, unfortunately. I don't know how he died. I was very shocked. So, I think that my own friends, the torch bearers of vaccine lobby are my own friends. जिनके साथ सालों में पढ़ा. It is just that they don't hit me, है ना? But they are very angry with me. How can I speak? I am maligning the whole medical education by opposing vaccine. That is the way they have learned it. So all I'm trying to say is that a sensible academic debate is not possible anymore. This is what I want to say. Now, if somebody would want to ask me why, I'll come to the leader. That is one question. Secondly, हमारे गुरुजी तो ये अपने अनिकेत और रश्मि ये मेरे पीछे पड़े हुए थे कि आप आइए और यहीं पे बस जाइए बेलगांव में गुरुजी से सीखे इत्यादि इत्यादि. I didn't go, so they even became angry with me. They stopped communicating. They were so angry with me. It is जय जगदीश हरे कि गुरुजी यहीं पे आ गए और इनके दर्शन हुए. मैंने जो इनसे सीखा, मैंने 23 साल की उम्र में मैं मेडिकल कॉलेज खत्म करके गांव में चला गया था. मैंने तब चरित्र संहिता पढ़ ली थी मैंने, और हमारे साथ पूरा वैद्यों का इलाका था. मैंने इनसे जो सीखा, जो मेरे को इट नेवर अकर टू मी. आई थॉट दैट आयुर्वेद इज इंडिविजुअलिस्टिक साइंस. इट ट्रीट्स अ पेशेंट. नाउ आई रियलाइज आफ्टर हिज टॉक कि आयुर्वेद इज फर्स्ट ऑफ ऑल ए पब्लिक हेल्थ साइंस. So that is the great contribution of his talk yesterday. Nobody in the Ayurveda has ever told me. I kept on challenging them. You people don't know public health. Now I know that Ayurveda is first of all public health. तो इसके लिए मैं आपका ऋणी हूँ. अब बाकी जो इनका जो काम है उसके मल्टीपल साइड्स हैं. सो जैसे मैंने इनको कहा कि आप तो सिद्ध पुरुष हैं. मुझे पता नहीं कि साथ में बैठे हुए कितने लोग सिद्ध पुरुष का मतलब समझते हैं. इट्स बीच में जैसे फकीर शब्द बड़ा मजाक का विषय बन गया, ऐसे मोदी जी ने सिद्ध का नाम लिया तो वो भी मजाक का विषय बन गया. इट्स अ वेरी सीरियस टर्म सिद्ध. तो इनका जो मल्टीपल नॉलेज है, वी आर नॉट रियली कैपेबल टू कैप्चर दैट बिकॉज ही इज सिद्धा, वी आर नॉट सिद्धा. पर जो इनके I think already Rashmi is trying to do that. Something which can and should happen, in which I am also ready to contribute, is that the cures which he has made, at least we should pick up 10 or 15 or 20 case studies and properly document it in a way a case study is documented. So that is something which I am ready to offer my services, that if you will do 20 case studies, we will try to strengthen it to make it a proper case study, which will bring some kind of modern legitimacy, which is important today, to what he has been doing. और तीसरी बात मैं कहना चाहता हूँ, आई डोंट नो वेदर आई हैव स्पोकन टू लॉन्ग, कि इस हॉल में there are, I think 50% or 25% people are those who are dealing with nutrition. Now nutrition is the foremost issue of our times, and I think Vijay ji should take lead to put them all together another day to make us discuss nutrition threadbare. And I will just put one example to you, that today transnational pharmaceutical industry is after obesity reduction drugs, which are very, very controversial. That is the one end of it. And secondly, we heard people saying here, again reminding us of malnutrition. Now, what is the problem in our country? Is it obesity or is it malnutrition? But no, still. So we have to think very seriously, because the side which is talking of obesity is not talking of malnutrition, and the side which is talking of malnutrition is not talking of obesity. So if we say what is our national challenge, we can't really say that. We have to say at least one thing. Na? If obesity is that, we'll say obesity. So then the message will come, okay, don't eat less. But if your message is eat less, so what will happen to the malnourished children? If there is so much of stunting in the country, now there is serious research which says that if the children will eat less, they will live longer. This is what the obesity people are trying to say now. So if our children are eating less, is it good for their health or is it bad for them? I don't know. तो आई थिंक कि गुरु जी के पास भी न्यूट्रिशन के बारे में प्रोफाउंड अंडरस्टैंडिंग है, जो विच हैज नेवर बीन कैप्चर्ड की व्हाट डज आयुर्वेदा एक्चुअली से अबाउट न्यूट्रिशन. तो आपने इतने सारे रत्नों को इकट्ठा किया, तो ये सब थॉट्स मेरे अंदर आए, तो मैंने आपके सामने रख दिया. आई थिंक आई शुड नॉट स्पीक मोर. आई कैन टॉक फॉर 7 days. आप गुरु जी आप अपना आशीर्वचन कहिए.
मैंने कई बार कई ठिकानों में आयुर्वेदोक्त आहार विहार है ना, अथवा आयुर्वेदोक्त आहार के बारे में कम से कम 3 घंटा टॉक दिया है, एक बात. और दूसरी और मोस्ट इम्पॉर्टेंट है, देर इज नो वर्ड इन इंग्लिश लैंग्वेज न्यूट्रिशन, देर इज नो वर्ड इन इंग्लिश लैंग्वेज एज फूड, देर इज नो वर्ड इन इंग्लिश एज diet. All these words are within 200 years. You can go and you can consult the etymological dictionaries of English languages. And these words, nutire, dieta, and not food but foda, foda, all these are coming from either Greek or Latin languages. So rather we may get some information from Latin or Greek literature but not from English. On the contrary, Ayurveda has dealt, and I think आयुर्वेद आहार विधि के बारे में बात करना चाहो तो कम से कम 3 घंटा लगेगा. So better stop here only, that the base is something different, and unless we go through it, just now it was said that as after retirement we come to know, और कन्नड़ा में ऐसा कहा जाता है इड़ित बंधन तीड़ित बढ़ते, यानी as we get aged or older and real sense or real knowledge we begin to get. Till then something secondary, but primary knowledge I think we get after retirement or after 60, like that.
So you have given your message for to everybody. I don't know. Has your message been delivered? You've given a talk. Overall, do you have a message to give to all of us?
Yes.
Please give.
No. Message to
all of us.
no,
You met all these brilliant people. So do you have a word of blessing or message to them? What do you expect? Want them to do?
Let them whatever they are doing, and they will come to know the truth, or rather absolute truth, after only, not at present.
Okay.
Because everything, for example, adalpin or adalpin acidics, I know it for about last more than 60 years. But in the beginning, though it was said that it has antihypertensive, this, that, but those, and when it had come to market, I think it was tested according to their criteria. But some persons who were using it for more than 20 years, in USA it was detected, it came to know that suicidal tendencies increase those who have consumed adalpin or adalpin acidics for more than 20 years. Same thing is true with mexaform. Mexaform, which has resulted into malignancy of the colon, then it was like that. I think there is no Ayurvedic medicine. It may be wrong with the either physician or Vaidya, but there is no medicine which can cause some side effect. A good Vaidya will prescribe or will hand over or will give the correct and proper medicine. Same thing is true with what our teachers told is there are only 1 or 2 issues where differential diagnosis is necessary. Otherwise, what our teachers said or taught, and they were both knowing, like me, integrated fellows, whatever we have got in Ayurveda is diagnosis and diagnosis only.
Okay, so there is lot profound thoughts in what you said. I will not expand on that. So I think this session is for first of all for people who have not spoken. So people should raise their hands and you want to run it, please.
So one, you have not spoken, so we managed
Adi.
to take care of that. And is there anybody else who has a question for any of our other speakers?
Bilkul,
Professor
bilkul.
Ritupriya spoke,
That is the other thing.
and then after Professor Ritupriya, Dr. Rashmi
Ji,
spoke,
ji, ji.
and then one moment, I'll put you at correct.
Later.
Just a moment.
Later.
And then after, then Sujit Ranjan and then Venkat. Venkat
Very
made
good.
his presentation interactive and he set the cat among the pigeons also.
Ji, ji.
So we meant to do it. It would have been easy to only invite few more Ayurveda Vaidyas, few more homeopaths. But the reality is that there is Covaxin and Covishield and that dwand, that tension is there in this space, isn't it? All of us agree, right? That there is that tension, whether I should only listen to my grandmother
Ji, ji.
or I should also listen to my daughter, which is very challenging. How should I deal with my mother-in-law? Some of you are here too, young people here, you'll all face that. So these things, whether it is Mahalakshmi or Mahashakti or what, the four powers, the four goddesses, the four feminine energies in the universe, how do we deal with it?
Very good.
What is it communicating to us? It's a very profound question. It's very philosophical, it's very spiritual. And we are living in times of what Rashmi said is Kali Yuga. It's one of the times or epochs in Indian sort of understanding of time. So how do we understand what is dharma in this time? What is right conduct? What is the best possible conduct? Not only for me, but what is, sarva hit mein kya hai? What is in everybody's welfare? So with those questions, are there any questions for Professor Ritupriya in this larger frame? Yeah, I think Dr. Hardik, please come.
A very good insight which I got today from a presentation was that all our researches, whether Ayurveda, homeopathy or yoga, are from the perspective of the modern medicine. Our reference point is modern medicine. So that was an enlightenment point. Now how to mitigate that? So that will be a challenge as a designer or as a healthcare professional. How do we redesign those researches? Now this is the question which I am now left with. I would like you to comment on that.
आपके लिए सवाल है.
I don't think that's really a question. I already gave one example, but each time you have a research problem, we'll have to think from the principles of your science. And I mean, go back to how Hahnemann actually did his research, and then let's see what is it that we need to design for the problem which is not to say that we only go back to his time. We also learn from all the others that we have around us, and but we don't only go by the reference point being the modern, and the modern model of research as it gives it.
So that's a key takeaway for me from these 2 days. Thank you for that.
Can I add to that with your permission and Dr. Ritupriya's permission? Look, that's very very clear on certain things. Like अभी इन्होंने एक बात कही है वो भी इससे जुड़ी हुई है. ये जो पूरा डबल ब्लाइंड कंट्रोल ट्रायल का एक इतना बड़ा हुआ खड़ा कर दिया गया, it was not there all the time. Most people were talking about this evidence-based medicine. With due respect to everybody, they are not aware that how did it come. It came with Margaret Thatcher. When Margaret Thatcher questioned their health setups, you are asking for so much of money, what is the evidence that your treatment is effective? Then they put a commission. And that commission found that most of the interventions the doctors are recommending have no basis. They have no evidence that it is effective. So they started this whole thing. So it's just 30 years old. Now they have realized, they fought amongst themselves. I don't know how many people know. And they are calling names to each other. The group has broken down. So this whole, facade of double blind controlled trial is there no more. But we keep on talking about it because the pharmaceutical industry has the greatest stake Like people have said here, they want single medicine, single intervention. That is their stake. So we need to do it. Now our ministry staffs do not know about it. No Ayurved people, no homeopathic people, no nature cure people have informed themselves to challenge them. Ki, why are you asking for double blind control trial? A single case which Guruji is cheating is evidence in itself. That has been discussed in British Parliament. That a single case is sufficient. But here we are not talking about it. So since you have taken interest in it, I will appeal to you and your fraternity, your homeopathic mission, to tell that to the ministry. This is not applicable for us. That is my answer to your question.
1 minute.
Please, please.
I know little bit of psychosora syphilis. I have gone through some of the homeopathy books, and I have gone through organon, and in 3 aphorisms, Heinemann has clearly written something regarding moral. Around 200 years ago, he was unable to explain it, so he left there and there only. And now I think for co-design, though not now, in future it will take place. Immediately it may not, because life after death or some other questions of rebirth which Ayurveda has dealt. Now modern persons like Ian Stevenson, who have studied rebirth cases from about 76 countries, out of which around 40,000 of cases, out of which 2,000 cases are complete. There is no doubt. And biology and rebirth, the 2 volumes are there by Ian Stevenson. So modern people are now coming to it, and what just now it was said that dharma, etc. Ayurveda says you follow dharma, and while following dharma, if at all you are sick, follow Ayurveda. That's all. So dharma kriya is something else which needs some rather enough time. And yesterday I told you that I have delivered my talk on Karmajanyadi, not of only of this life, but of past lives regarding which Ayurveda speaks, and that to be more precise, Janmantara Shatishu, that is for last around hundreds of lives, past lives, we are suffering from various disorders. One thing, and this will guide us, though model. I have also delivered a talk in homeopathy college for only final BHMS and PG in homeopathy. At the same time, I have delivered my talk on Karmajanyadi for final BMS and PG in Ayurveda. What are your questions? But I think 2 persons like myself and even at present my teacher who taught me so many things is yet alive, and now he is 93 years old. But even then, I think you people come to us. I will see that Galadeva sir comes to us, and whether Karmajanyadi works not, whether rebirth is possible or not, because he has worked more on that. Number of articles have been published, and he has presented his research papers on mind is matter. One thing. Second is survival after death, like that. So that needs parapsychological studies, and without parapsychological only studying by medicine, no. That is why I think that I'm hopeful, though immediately probably Madam may not answer, but I think it has begun now. The process has begun. She will tell, somebody will tell, and slowly that will go ahead. That in that way I'm hopeful for that one. Thank you.
So more questions for Dr. Ritu Priya?